What do people receiving cancer treatment need to know about the COVID-19 vaccine? Here to talk about this, Dr. Gradon Nielsen, an oncologist with Virginia Oncology Associates. Doctor, thanks so much for joining us today.
Thanks so much for having me.
I know that you get a lot of questions about this. What are patients' concerns about the vaccine?
So a lot of my patients ask, in terms of the COVID vaccine, if it's safe for them to get while they're receiving cancer treatment. They're also interested in knowing if it's going to be effective for them. So it's extremely important that cancer patients do receive the COVID vaccine because they're at increased risk of developing severe symptoms from COVID. They're also more likely than the general population to contract COVID. So I recommend to almost all my patients that they do get the COVID vaccine.
I know you were talking earlier with me about timing and how timing is really important for when cancer patients get this particular vaccine.
So the ideal time to get the vaccine is before you start treatment and before you're diagnosed. And there's often a little bit of a delay between when someone's diagnosed and when they start treatment. So if possible, the best time to get the vaccine is before you're receiving treatment. If that's not possible, then we usually work the vaccine into someone's treatment a week or two after they receive a treatment. That way their immune system is a little bit boosted and better shape to take the vaccine and develop immunity from what they've received.
How about for cancer patients who have had COVID?
Yeah, so our bodies do an incredible job of developing immunity after we've had infections, but over time immunity typically begins to wane. So I recommend to my patients that they do receive the COVID vaccine even if they've been infected in the past. And what that will do is lower their risk of developing infection again. And if they were to become reinfected, they're much less likely to have severe infection if they did receive the vaccine, even if they've had COVID in the past.
And how about other vaccines like the flu, for example?
So if patients have completed treatment and they're a survivor of cancer, we would recommend that they get standard vaccines. That would include things like the influenza vaccine, the shingles vaccine, and the pneumococcal vaccine. If someone's currently receiving treatment, then the only vaccine that we would recommend that they get on top of the COVID vaccine would be the influenza vaccine. And so they would need to work with their oncologist to time those vaccines, typically to be given a week or two after they receive treatment.
Patients may have questions about this. Where can they go for answers?
So I would recommend that they go to our website, virginiacancer.com. There's a lot of great information on there. It's also important that they talk to their oncologist to see if their situation is different and they need to have specific adjustments to their recommendations.
Dr. Nielsen, thank you very much.
Thank you.